Good morning. I am Dr. Shilpa Karkera, Assistant Professor of Department of Neuroscience and Anatomy, Trinity School of Medicine. My topic of presentation is Impact of COVID-19 on Future of Cadaveric Dissection and Anatomy Teaching. I would like to thank SciTech Central Conferences for giving me this opportunity. So first important thing what we have to know here is COVID-19 pandemic has left a major impact on medical education globally. We are undergoing the crisis for humanity with this virus, which is causing extensive damage to its life as well as its aspect. All the academic classes were suspended during the national lockdown to ease the propagation. And it's a high time to rethink how exactly we can deliver the medical education under these restrictions of social distancing, and how are we going to teach or discuss main aspects. So what we have proposed is we have replaced, especially in my department, we have replaced the anatomy and neuroanatomy dissection with virtual dissection. Now, when it comes to virtual, it is not face-to-face, instead it is virtually taught. So before that, how we were doing dissection is, these are the different methods or techniques how we usually do our dissection in 101 class or in a face-to-face class. So first important thing is our cadaveric dissection. So if you see here, this is our cadaveric dissection. This is our cadaveric dissection. So anatomy is taught based on the region wise. For example, in this image they are focused on head and neck region. So if we want to know the different nerves of your face or different glands of the face, they usually do a dissect these region. They flap the skin and we start going through layers by layers and show them the structures. So this is what we do in a cadavers in different regions. The next is, if we want to make them know or make them understand in brief, we even draw few diagrams, we show them few pictures and also animations. So if you see this image, you can see how the blood which is pushed from the right atrium into the right ventricle, and how the tricuspid valves and the bicuspid valves and the aortic valves or the pulmonary valves exactly opens, or there is a dilatation or the constriction takes place. So this gives the students a three-dimensional idea to know how exactly the blood flows and what are the different functions of these valves and what happens to the chorda tendineae and what happens to these muscles, and many other things are taught. Next, we also deal anatomy with osteology, show the bones to the students and make them understand, make them feel, make them touch, know what is groove, what are the muscles attached to the rough area like tuberosity. So there are so many things we usually teach in gross anatomy or in a human anatomy face to face. Along with prosected specimens, we even teach them embryology models. What is this embryological model? You can see here, each and every gestational age, fetuses are being kept, and we even show them at this age what are the organs developed at that age and how exactly the tongue is developed, how exactly the lungs are. So this is how the main gross idea how we deliver the classes whenever it is a regular classes. And plus, along with this, we also teach students with virtual dissection also. That is by, can you see here, it is by the anatomy table. We even show the students how exactly the structures are. So these are the actual three-dimensional view as well as these are the practical view. So we show the students and teach the students in this way. Now, during COVID-19, what has happened? The way of teaching is completely changed. So what we have done, if you see in this image, the entire labs have been shut down. So there is no academic staff, there is a breakthrough in teaching, and we had to rebuild and re-innovate the resources. So how are we going to do? So what we have done is we have merged the anatomy exact face-to-face teaching in these teaching into a digital base. But in this virtual mode, it has helped the students in other way, because we had no other go. We had to go on with the classes, so we had to do a virtual teaching. So these are the new inventions which has made the life easier, or it has helped the students in getting to know the subject. But there are a lot of studies which is done to know or to face the challenges what we really felt during anatomy teaching. Now, so the study which is performed by, so I would like to speak on two of the studies which is done by UK and Irish universities. So in this UK and Irish universities, the 14% of universities, they did not have practical exam. As I already told you, we have a regional way. So we teach the students, we train the students, and we even ask the practical. There is a practical exam which is according to their curriculum. So what are we going to do during this pandemic? So in UK and Irish studies, around 14% of universities, they did not have practical exam. So, and then even in 36% of universities, they even cancel the assessment, like theory assessment also. And 21% had an online digital spotter examination. So as I already told you, spotter means we keep the structures and we point them and we ask them what it is. So around 25% had the online digital examination. And in the same study, 21% showed the concerns in regards to professor-student relationship. And also 14% on assessment, 7% on temporary suspension of body donation program. Because of the lack of technical support, even body donation program also was suspended because of this COVID-19. So hence, COVID-19 has impacted not only the living, it has also impacted the body donation, it has also impacted the many universities in their curriculum and exam taking manner. There were a lot of studies which is done. So if you see here, because after this pandemic, now we are out of the pandemic is 2021 or 2020. There are a lot of studies which also showed that students are now not interested to enter into the anatomy dissection, because they feel that formality lies too, and already they know that they have been dealing with the anatomy classes without dissection, without models, without practical exams. So they feel that dissection should be eliminated from the curriculum. So there was a study which was done where I have put a pie chart here. So if you see here, around 62% of students now feel that the dissection should be eliminated from the curriculum. They strongly disagree. They tell that 62% students tell that they do want their dissections, and even 24%, that is, they disagree. They feel that dissection is required, and 11% students are neutral. They are like in between. They are just wondering whether they really want dissection or not. They are just waiting for others to tell. And among them, there are few students, they even want to stop the dissection. So now, because of the pandemic, not only it has impacted globally, it has also impacted the students' mentality towards the cadaver. So now the students feel that cadaver is a lot of formaldehyde and it is not good for their health. They just want to stop the cadaveric dissection. They don't want any practical examination. Instead, they want directly a theory examination, or they don't want to attend the classes. So now, so what few studies have meant that there are multiple benefits on the dissection which helps in hands-on dissection. That means we have to favor the hands-on dissection and the virtual dissection. So there are a lot of countries which have made a study, or a lot of studies which is done by many of the researchers to check which is better, whether the dissection is better or whether the virtual dissection is better. There are few authors, they also mention that both dissection as well as virtual dissection it should be giving equal importance, and it should go hands on hand. That means whenever there is any cadavers, we also should show them 3D structures like dissection, like anatomy table. So by that they will understand what is difference between the virtual dissection, what is the importance of the face-to-face dissection. There are a lot of advantages of dissection which is mentioned here. Cadavers are like silent teachers for the medical students. So if students have any difficulty in understanding where exactly this is the structure of the head, you can see the brain here, lateral wall of the nose, there is a mouth, oral cavity, there is a larynx and pharyngeal cavity. So they will know where exactly these structures are present. By knowing that, the students will take advantage of this cadaveric dissection. Okay, as well as it also allows the students to make use of scalpel, because you know that they should know how to differentiate blunt forceps. They should know what is tooth forceps, what is pointed forceps. So once they know different type of scissors, different type of forceps used in this section, it will be easy for them to go to their next level. Whenever they are in a surgery department, they will be identifying and they will know how to put an incision and where exactly the incision has to be done. So that is the main advantages of dissection. The next is advantages of virtual dissection. As I told you, now we are in 22nd century. So we should know what are the structures which is present, and we should even know not only in the cadavers, we should also know technically where exactly these structures are present and where is a block, or maybe where is a fracture, and everything should be known. So even virtual dissection also plays an equal important role. But what is a drawback? So as I already told you, there is a pros and cons in both the aspects. In virtual dissection, the disadvantages are you will not feel the body, you will not know where exactly. Actually, first in anatomy dissection itself, we will be touching each and every muscle externally, and we will palpate where the structure is, where the artery is, where the muscle tendons are. Everything is dealt in the face-to-face dissection. But in virtual dissection, you will miss that. You will just see the images like what you saw here. Okay, there is an artery present, there is abdominal aorta and many other things. But you will really miss the structure. You will the palpitation, all the other things will be missed. So we have to actually have a combination of both cadaveric dissection with the virtual dissection. That will really help the students to understand the subject in detail. So in this case, this is a literature review, the study what I have done. The hypothesis of the study is the students can adequately learn anatomy by using different modalities and approaches. I don't tell that cadaveric dissection is more important or most important, but I do tell the cadaveric dissection is very, very important, because in cadaveric dissection, we will have a student ratio of 10:1. So if there is a 10 student and we will have a one body, so we can see each and every structure whatever the professor is dealt in the class, it will be shown in the dissection hall. So it makes the student to know the subject well in detail, as well as it also helps in students in identifying how exactly the muscle is present, where exactly the nerves are present. So that will give you a brief idea, or it will help you in self-discovery, or it also helps in knowing any anomaly or if there is any variation in the structure. So these all are the helpful things which is more important or most important in cadaveric dissection. But virtual dissection is like a video where we see everything. So if at all, as for my opinion or my experience, I feel that both cadaveric dissection as well as virtual dissection should be given equal and importance. So what will happen? if at all, if we are going on, because nowadays, as I already told you, new generation, they don't want to spend a lot of times in their dissection hall, or they don't want to get exposed to the formaldehyde, and they feel that we are dealing with many other topics like additional notes we will be giving on the subjects, or so they feel that it is too much. So what I feel, according to me, as the years passes, the cadaveric dissection will be reduced, and if you see here, these are the different type of methods will get the more importance. So that's the reason it is my humble request. This pandemic is gone, and we have to get back to our own way of teaching, or our own pattern of teaching, so that will really help to give successful doctors. And these are my references, and thank you so much for giving me this opportunity.